A warm welcome to everybody. I'm Dr. Lakshmi Nirisha, Assistant Professor of Psychiatry, Telemedicine Center, Nimans. Today, we shall be discussing handling crisis and other challenging situations that a counselor encounters during a counseling session. First, what is crisis? Crisis refers to sudden unplanned events which cause major disturbances in the individual's life and trigger a feeling of fear and threat in the person. When an individual's coping mechanisms are affected due to the circumstances, in the absence of mental illness, it leads to crisis. So basically, it means any normal person, any individual with no pre existing mental illness can also encounter significant difficulty in handling a situation which can present as crisis to the person. What are the stressors and situations that can lead to crisis? One is loss, changes in life situations, and problems at various life circumstances of an individual. First, coming to loss. Loss can be through death of a dear one, which can be a family member, friend, separation, divorce, financial losses, and physical illnesses, which is basically loss of health. Change in life situations, such as change in job, shifting to a different place, marriage, retirement. Problems at work, wherein difficulty in adjusting to a workplace, problems in relationships, financial difficulties, and legal issues. These are the few situations that one encounters a crisis like situation in their lives. What happens when a person experiences crisis? First, the initial threat, the event itself, which leads to anxiety, where the individual attempts to resolve the threat. If the person is able to resolve the threat, there would be no crisis. However, if the threat is not resolved, the distress increases, anxiety increases to a serious levels. Then, consequences of the anxiety, which can be positive and negative. Positive could be that the individual makes attempts to solve the issue, and then, if successful, then he or she goes on to cope with the crisis. But if the person is unable to deal with the anxiety, which could negatively impact the person's ability to resolve the issue, can ultimately lead to panic. What are the consequences of panic? If an individual is still unable to resolve the threat, it leads to disorganization in thinking, affects one's emotional reactions, sleeping, and ultimately his or her functioning. So, what are the normal reactions to stress or crisis? It's not always that a person's reaction to crisis is always abnormal. All of us experience some kind of crisis in our lives, but it's not that everybody has decompensated or everybody encounters major problems while dealing with this crisis situation. So the normal reactions are feeling helpless, feeling confused, having anxiety, experiencing sadness, anger, erratic thought process, where one is unable to organize their thoughts, sleep disturbances. Most of the time, when an individual encounters crisis like situation, he or she will develop sleep disturbances in the form of decreased sleep. Physical symptoms such as body aches, for example, headaches. So, what are the abnormal or serious reactions to crisis? Like we saw in the previous slide, those were the normal reactions that anybody can encounter, anybody experiences, and most of us would have experienced such problems while we have encountered a difficult situation in our lives. So now, what are the abnormal or the serious reactions? The serious consequences could be depression, where a person with no pre-existing mental illness, no pre-existing mental problems, or having taken any kind of medication or treatment for a mental illness, could develop a new onset mental illness such as depression. Violence, reacting in a very aggressive manner, where a person can become aggressive and go on to become physically violent towards others in the family or outside. Agitation, becoming extremely restless, crying and screaming, self harm, experiencing ideas to commit suicide, or presenting with a suicidal attempt itself in an attempt to deal with the crisis. Now, what are the extreme responses which require immediate referral? That is, when you encounter as a counselor such situations, you need to take a step to immediately refer the person to a setup, whether it can be a mental health institute or a hospital where these situations can be handled. First is a recent suicidal attempt. If a person has attempted suicide by either consuming medication or by trying to end their lives by using physical harm, it is important that they needs to be addressed in view of possible medical complications. So therefore, they need to be referred to a immediate hospital for need for psychotropic medication, that is any kind of medications to treat a possible mental illness, and also to deal with the medical complications that would have arisen due to the attempt. Resorting to aggression. If a person becomes extremely aggressive and is not amenable to any kind of verbal discussion, which we call as verbal de-escalation, then the person needs to be referred. It is always important to remember is that if a person is being aggressive, and as a counselor, when you attempt to discuss or talk to this person, if the person does not comply or if the person does not calm down, then it's always important to take a step back and take necessary steps to refer the person or take shift the person to a place where he or she can be kept in a place to prevent harm to himself or herself and to others. So always when you perceive threat to yourself, perceive threat from the other person, always take a step back and keep yourself in a safe distance. When a person develops new onset psychiatric symptoms, such as becoming suspicious, having odd experiences such as hearing of voices, not eating or sleeping well for days together, and completely becoming forgetful. That is, at times, some people can experience that they have forgotten about the situation at all, and they any attempts to try and discussing with them, they would say that they don't remember such an incident occurring, especially when somebody has experienced a very significant trauma, such as experiencing sexual assault or a significant physical assault by another person. Substance use. If a person starts using substances such as alcohol or any other drugs, or if a person who's already using them increases the use, which leads to issues related to intoxication, where a person starts drinking more, resorts to issues such as drinking and driving, for example, and starts behaving in a rash manner, they need to be referred to a setup where their substance dependence can be handled and subsequent treatment can be given. So these are the few situations where, as a counselor, you may not be able to provide much help, but at least the immediate help that is needed to safeguard the person and the people around the person is what your role would be. What is the role of a counselor in crisis? So counselors, as you all would have heard in the previous sessions, can be anybody. It can be committee members, it can be volunteers like yourself who is volunteers of like yourself who is encountering such situations. And as counselors, you play a very major role in handling crisis. The counselor helps to identify and intervene at the earliest, reaches out and provides immediate help required before the crisis causes long-term damage. So basically, a counselor provides first aid to the person. What is the goal of counseling in a crisis situation? So now coming to the crisis counseling per se. So help the individual to return to the previous mindset or equilibrium, basically bringing back the balance of thinking, balance of their emotions back, providing relief of emotional disturbances, providing support which is unconditional. Whatever situation may be, a counselor would provide an unconditional support to the person, providing reassurances whenever necessary. So it is important to focus on the current situational difficulty and find ways to cope with the situation. This is important because as and when you're talking to the person and the family, there might be other issues that you might identify. But it is important that when handling a situation which is causing crisis, that needs to be given importance rather than the other factors that could have even gradually led to the particular crisis or the situations of the past. So, what is the purpose of crisis counseling? The purpose is to reduce the individual's physical, emotional, and behavioral reactions to the crisis, Focus on short-term strategies to mitigate the effects of the situation. Help the individual to cope with the current situation. Return to normalcy at the earliest. Thus, to prevent long-term side effects of the crisis situation, such as developing mental illness, depression, or post-traumatic stress disorder, which can be seen in individuals who have encountered significant trauma in their lives. And to help the individual return to normal functioning at the earliest. Last but not the least, an educational component also is there while dealing with crisis with the person. The component includes ability to cope with the current situation, subsequently helping them to deal with future problems. Therefore, ultimately, making their problem solving skills better. So, what are the strategies to be employed in crisis counseling? First and foremost, to remain calm and appear to be in control of the situation, allowing ventilation. Ventilation is nothing but allowing the person to cry or let out their distress without any hindrance. Example, if a person is crying, let him or her cry, allowing anger or sadness to be displayed. Listen and explore the situation the person is facing. Normalize the reactions. That is, it is okay to feel like this. These kind of statements are very beneficial when you're providing crisis counseling. Acknowledge the perceived severity of the situation. What the crisis means to the person is more important than what the crisis actually is. This is important because as an individual, like I said, all of us would have experienced some kind of crisis in our lives. So while listening to another person's difficult situation, it might appear that this is not as difficult as I have faced, or somebody that somebody that I know has already faced. So it's important to acknowledge what the person is perceiving. If the person feels that this is a very big problem for me, then it is important to acknowledge that severity. Statements such as, you must be feeling hopeless about the situation, all your attempts have not been successful. So statements like this makes them feel reassured, makes them feel confident that he or she can talk to you about their problems. Identify the prevailing mental strengths. So while addressing crisis, it is important to identify what the person positives the person holds, the mental strengths he or she holds. Problem solving should focus on one issue at a time. That is, don't bring too many issues like what happened in the past or what the person had done in the past, rather than focus on the here and now situation of the crisis. Avoid probing about the past in the initial phases of crisis counseling. What did you do last time when you had a fight with your spouse? Statements like this should be avoided. This will make, as a counselor, the person might perceive that you're being judgmental and indicating that he or she might be incapable of handling the situation. So such statements should be avoided. How to provide crisis counseling? See the person as early as possible, preferably within 24 hours of asking or calling for help. If you're working in a center where a person or a family member or other person has approached you telling that such and such an individual has faced a situation where he or she is unable to handle, try and reach out to the person in need within 24 hours. Establish a therapeutic relationship. This is vital and itself can be therapeutic and itself can be helpful to the individual. Voice out that you are there to help. Be non-judgmental. Verbalize the person's feelings. As earlier you would have heard about paraphrasing and reflection. That is, rephrasing their thoughts in a simpler manner and talking it back to them, and also make them reflect on their own uh, emotions and their speech. Encourage that the situation is not hopeless and that you are available to make the situation better and help the person deal with the situation. Identify risk factors which may warrant immediate referral, like we have discussed earlier. Any recent suicidal attempt, a person who is resorting to using alcohol or other substances to deal with the situation, or there has been an event of becoming aggressive, that is physically violent. So such risk factors have to be identified, and if present, refer them immediately to the nearest center wherever the appropriate help may be provided. Evaluating the crisis situation, assess if the situation and the patient's reactions go hand in hand. That is, if for example it's a very minor situation and the person is reacting very abnormally, then that also needs to be taken account. Assess the family situation and its relation to the current crisis. Things such as if the family is available, is the family aware of the situation, what is occurring around the crisis, that needs to be assessed, and past crisis situation and how it was handled. This is important. It might appear contradictory, like what we discussed in the earlier slide, that we need to not look at the past. But it is important to try and explore the past situation, crisis situation the individual encountered, and how the person had handled, so that we can gauge the person's problem solving ability and his ability to deal with the problem in the past. Identify the precipitating event. This is very important. The reaction may not always be proportional to the severity of or intensity of the precipitating event, but still it is important to know what it means to the person. Identify support systems you can utilize in the therapeutic plan. How solid and reliable are certain members of the family? What the community resources around the person are which are available to you? And what are the strengths of the family with whom the patient lives? It may not be a family per se. Sometimes it can be just friends or neighbors if a person is living in a remote city alone. So those resources should also be utilized while you're providing crisis counseling. Be empathetic and provide reassurances from time to time. This is essential to enhance the working relationship and to restore hope in the individual. Communicate that you are aware of the person's difficulties. The patient should be helped to realize that the problems are stress related and not because of the individual. Instill hope that with guidance, one can learn to deal with the situation and resolve the problem. Dealing with the present. Avoid attempts to probe past too often and trying to resolve those issues before the current crisis has been settled. This often causes unnecessary hurdles and it might actually take away the focus from the current problem and may impact your crisis counseling in a negative manner. Focus should be to explore the corrective measures for the present. There might be past issues which, as a counselor, you might feel it is important to address, but focus on the current situation. And once that is resolved, you can always go back and talk to the person, discuss with the person what happened in the past so that we can enhance or we can look at the person as a whole subsequently. Involve family and significant others in the plan, like discussed in the previous points, exploring the support systems available, because crisis often affects the individual and the family too. Therefore, it is important to involve the family member. It also helps to monitor the individual against a possible risk of harm, monitoring medications if there are any that have been prescribed by a doctor, to share responsibilities with the person. If it is a burden that the family members can also share, it is important to involve them and also counsel them about sharing responsibilities with the person in distress. So, how long to continue counseling sessions and when to stop? This is important because as whenever you're facing a, a situation which is quite traumatic to the person will want to keep continuing to come to you or continue a session very long. So usually a crisis counseling will last for about 4 to 6 sessions, approximately, let's say about an hour session each. Maybe first or second session might go on little long, but usually 4 to 6 sessions would be sufficient. Long-term help may be required if vulnerabilities such as personality problems, chronic concerns of trauma has had an impact requiring long-term therapy. For example, such as a person who has suffered sexual assault or physical assault. These issues may often require long-term structured therapies, needing referral to a mental health professional, a psychiatrist or a psychologist who will be able to provide long-term therapy and also look at other forms of therapy that can be utilized to help the person better. So this ends our dealing with crisis situation per se. Now coming to our next part of the next part of the session is dealing with a challenging situation during counseling. So while already some of you might be counseling people, or you might have heard from previous experiences of counselors that at times, even though you're starting off to be a counselor, you're learning, you're teaching, it can that you can arise situations where you feel stuck. So now let's see how we can deal with some of those situations. So what are the likely challenging situations that you might encounter during your process of counseling people? Prolonged silence. Sometimes silence can appear like it is speaking a lot, but for a counselor, it sometimes might appear, what he or she should do next. So prolonged silence is quite common and can pose a challenge for you as a counselor. Extreme emotional reaction, such as aggression or crying suddenly. Individuals with suicidal ideas. Excessive external interference, where family members are talking too much or they want to contribute too much when you're sitting in a group. Transference and counter transference. This is basically the emotional or the personal emotions that the individual experiences towards the counselor itself. For example, it could be from past relationships the person might have had. The person who requires help, the counseling, can have feelings towards the counselor which can impact the counseling session itself negatively, which we call as transference. Counter transference is what you as a counselor might develop towards the person who is seeking help. So in such situations, you can encounter that you're unable to deal with those feelings which might interfere and impact your counseling negatively. And lastly, what to do when you don't know what to do in a counseling session. This can happen because it's not always that we know solutions or we know how to deal with situations always. So there might be situations where you really wouldn't know what to do with a situation where you don't know what to do. So how to deal with a difficult situation? Accept the situation and try to process what the hurdle you're facing. So it's important, rather than you developing anxiety or feeling panic kind of symptoms while dealing with a situation which appears that you cannot solve. Do not give up at an early stage. If you feel that there is something that you've encountered which you're unable to solve, do not give up. Wait for it. Take your time. Maybe have a couple of more sessions and then go back and see if you need to refer the person to another counselor. Go back to your counseling process, what you've learned in your previous sessions, components of active listening, reflective listening, being empathetic, and other strategies need to be looked at if you have missed out any of these components, and revisiting those points and revisiting those factors that you might have missed out might actually help dealing with the situation. Revisit your role as a counselor and the targets you have set for the counseling session. So often it happens that while doing a counseling, providing counseling to a person, you might actually forget your role as a counselor, like whether you're guiding the person or whether you're providing advice. So these roles have to be clear when you feel that you're getting stuck. And what are the targets? So sometimes it so can happen that we might set multiple targets, and we lose a track of what kind of a target are we trying to focus on a particular session. So it's always good to go back and look at those targets. Clarify with the person through questioning, and ask the person that you haven't understood a certain problem and you would like to know more about it. It's always good to do this exercise, that when you have not understood or when you feel stuck, to ask the person that you have not understood a particular thing. This might actually not reflect negatively, like you might actually think of that the person might think that you are incapable of providing help to them, but it might actually enable the counselor or the client to discuss more issues with you and also discuss their problems better. Seek advice from your peers or a supervisor who might be supervising you whenever you feel it is necessary. It's always a good idea to talk to your peers, your other counselors, that you have faced such a situation, or you're finding it difficult, or you're unable to proceed further in a while counseling a person. So sometimes you can get through others' experiences, or a supervisor who has more experience can help you deal with that situation. So first, coming to dealing with prolonged silence. Like I mentioned earlier, silence is quite common during counseling sessions. So silence in a session may indicate many things. That the client has not finished, may have finished what he had to say. That the client has nothing much more to say beyond whatever he or she has expressed to you. Maybe thinking of what to say next. Maybe reluctant to discuss the issue further. That he or she feels that they cannot talk or they should not be talking a certain aspects. Maybe overcome by feelings, sometimes extreme distress or sadness during a session might the person might feel it's good to stop talking, and uh, that they cannot really talk anymore because the feelings become too overwhelmed. Maybe experiencing a mental block, maybe considering some important thoughts which might have just occurred to him or her, which or something that the counselor might have suggested might make them feel that they need to think more and want to express more to the counselor. May want some reassurance from the counselor concerning an issue which has been just discussed. And lastly, maybe feeling hostile towards the therapist or the counselor. The person might feel that this person might not really help, so why should I really talk? So the counselee or the client might become hostile towards you, and decide that I don't want to talk to this person, so I will remain silent. So see which of the possibilities that we have discussed in the previous slide. What of the possibilities might be the cause for silence? Often the trigger may be the issue which has been discussed immediately. For example, things like what makes you feel like a failure. The counselor will need to break it and guide the client to move ahead. Statements such as, what is it that you were thinking? Is that in something more that you want to tell me about this particular thing that you've been telling me just before? If the client is uncomfortable to discuss a particular issue, reassure the person and tell the person, express to the person that I think you are uncomfortable to talk about this. Do you want to talk about it sometime later, or maybe we can discuss it on another session and shift to another topic so that you can come back later and point out to them that are you ready to talk about this particular issue now? So you can always give such reassuring statements and time to the person if you feel that there is something more that an individual needs to discuss with you. So dealing with crying during counseling session. Crying is actually quite common when, especially like we have discussed about how, when somebody experiences crisis, and may often appear very unexpectedly during the session, that, something the person is talking, something very neutral, or, and he or she suddenly starts talking, starts crying. So what to do then? Should you stop the person or should you allow the person to cry? This is the first dilemma that would set in your mind, that what you should do, whether you should tell the person, okay, no, I think we should just go back and talk to the issue that we were talking, or should you allow the person to cry so that you can wait the person to calm down on his or her own. So because often what happens is, especially when you're early on, when you've started counseling people, crying makes the counselor himself or herself very uncomfortable. So it's important to try and make yourself comfortable. At least don't show your discomfort. Try and keep your emotions contained. This can become a problem, especially when you're dealing with the people who are talking about losses. They're talking about death of a family member, death of their loved one. So the counselor himself might be overcome with significant emotions, so and start making he no you uncomfortable, so that you can feel stuck as to what I should do next, because I myself am feeling so bad or so upset about this situation. Stopping the person from crying, it's not really a good idea to do that. Always statements that don't cry, it's okay, I don't think there's any need to cry now, don't worry. This is actually comes across to be quite inappropriate. The counselor should not feel embarrassed with the crying. If the person is crying, do not feel embarrassed and do not try and interrupt the person very soon. Let the person cry for some more time, or he or she feels like that he or she wants to cry, then let the person cry. So crying actually indicates that the client trusts the counselor. He or she is ready to discuss and let their innermost emotions visible to the counselor. And as a counselor, you should take this as an opportunity to discuss their emotions and whatever inner turmoil that they might be experiencing. Acknowledge the distress. Statements such as, this must be very upsetting for you. I can see that you're quite upset talking about this alone, and it might be quite distressful that you had to experience go through this whole situation. So statements such as these can be quite helpful and actually help the person calm down faster. Dealing with inappropriate emotional experience expressions such as display of anger, hostility, I don't want to talk to you, you know or why should I even be talking to you, why should I even be sitting to you. So this is nothing but hostility coming across extremely close. It can be quite difficult because, like I said, you have a professional boundaries to be maintained. So sometimes when a person tries to become extremely personal and close to you, it can become quite inappropriate, and you might find it quite difficult in such a situation, and this often hinders the progress of the sessions. Display of anger should be allowed to a certain extent. If he or she is talking about anger towards others, or just when it can be a matter of just ventilating their emotions, so that can be allowed. But when you feel that you are feeling uncomfortable, or you are feeling that there is a threat from the person, always indicate your discomfort when the to the client, and also tell the client that he or she probably should try and not become angry towards you. Avoid usually aborting the session abruptly. If you think the session is going, you're unable to cut down the person's emotions in terms of his anger, or the person is becoming extremely hostile, avoid stopping the session abruptly. Or if the client becomes too personal to you, seeking physical assurance, wanting to hug you, or expecting that you sit next to them, so things like this might feel normal to them, but as a counselor you might not be comfortable. Always explain to them what your role as a counselor is, that it's a professional relationship. You are there to understand their situation, trying to help them unconditionally, but physical reassurance is something that you are not comfortable with. Be firm in your statements. There is nothing wrong to say that this particular thing is not acceptable, like being too personal, or hurling abuses at you, and the fact that you are a person who's there to listen to them and help them, and that such inappropriate behavior may not be acceptable. Next, coming to dealing with suicidal ideas. It's nothing but almost very similar to how you would be handling a crisis. Suicidal ideas, or somebody who has planned of suicide, or somebody who has attempted suicide sometime back, it can be quite difficult, talking to them sometimes. But always ask about it. Never feel uncomfortable, or never fear talking to a person who's talking about death, wanting to die, or wanting to commit suicide. Never be uncomfortable. Always talk about it. Let the person talk about the suicidal ideas, because talking about suicide, or asking a person that he or she has suicidal thoughts, does not increase the risk of suicide. On the contrary, it actually helps the person deal with their thoughts that they have, and possibly prevent the idea to go on to become an attempt. Assess always the immediate risk of suicide. Ask if the person has active plans, or has made recent attempts. Active plans, for example, something like ask the person if he or she is looking for ways to commit suicide, or for example, if he or she has looked at online about methods to die, or if he or she has made an elaborate plan how to die. Things like purchasing medications, or getting a rope, or getting some poisonous material to commit suicide. So ask them if they've made any such plans. Check for depression. Ask for low mood. Ask for if the person is feeling too tired, sad, feeling hopeless, feeling worthless of late. So always asking for depression is important. Involving other support systems. Even if the person disagrees or does not want to talk about their suicide thoughts, it's always important to inform the person that it is important to involve family and friends to prevent it to become an attempt, or prevent harm to the person. So you can always inform the client, and then bring the family and friends into play. Talk to them. If the person is living alone, or if the person is doesn't have any support systems available, try to gather some supports from the social agencies. For example, there are NGOs which try to help people who have experiencing suicidal thoughts, or some center which can support the person or monitor the person. So such social agencies can be also looked at if the person is living alone and or has no family. How to deal with external interference? Often, there might be multiple other people who might be wanting to advise the client, which may hinder your counseling. For example, you might have discussed a certain issue with the client, and discussed with how he or she should approach a certain problem. The person comes back to the next session and says, no, my friend told me this, or my family member told me this. So this might often hinder the progress of the counseling itself. So be aware of such situations and intervene accordingly. If necessary, always call. If it's a family member who's repeatedly interfering, you can always call the family member, explain the purpose, why he or she is attending counseling, and also, subtly talk to them about not interfering with the various steps that have been discussed with the client. Clarify and discuss with the client the targets and what was discussed in order to achieve those targets. This is again important to reemphasize to the client that the relationship that you as a counselor and the client have are to achieve certain targets, and that efforts have to be made from the client's end to achieve those targets, even though there have been advices and guidance from external factors such as family or friends. Lastly, what to do when you don't know what to do? So, as you can see, the statement itself is so confusing, it's so repetitive. So, this might actually happen when you are in a counseling session. I too have experiences such situations where, I feel totally stuck. I don't know how else to proceed. I don't know whether I should stop, whether I should, call somebody in, or whether I should say the person, no, no, look, I don't know what you're saying. Maybe I'm not the right person. So, what to do then? So, this is a very common situation, and example that you don't know what to say or ask the person, or how to proceed with the session itself. So things like asking questions, these set of questions that I've displayed here, these questions can actually help you, move forward in a situation where you feel stuck. For example, what do you like about yourself? So exploring other factors around the client. How do you take care of yourself? So this basically helps to explore the problem better, understand the individual better. Who are those people in whom you confide? If you feel the person is not confiding, is not talking to you, you can always ask the person whom or she is willing to confide, subsequently asking why he or she is comfortable to talk to a certain person but not to you. How do people around help you? So also knowing what kind of help systems are available around the person. It so can happen that the person might generalize that my family doesn't understand me, my friends don't know how to help me. So what's the point of talking to a counselor or telling them a certain issue? So this might be the reason the person might not talk, or might not be giving you the information that might be required to help the person completely. Another statement is, how do you allow people around you to help you? So methods, how he or she seeks help, whether the person asks for help, writes for help, or doesn't really talk to people about wanting help. So these are the few examples how you can allow the session to proceed. So still, if you feel that you're having difficulty, you're unable to really deal with the situation, it is a good idea to go back and tell the person that, look, for some reason I think I'm unable to help you with this problem. If that's okay with you, we can always discuss it later. Let me go talk to my supervisor. Or still, if you feel that you're not able to help the person more, you can always refer the person to another mental health professional. So that should be not the last resort, but try other techniques. Always, because there has been some kind of a rapport that has been established with you. The client knows what has expressed to you, has spoken to you. He or she has some kind of relationship, therapeutic relationship with you. So try and utilize all these factors, and subsequently only you can refer the person to another client, another counselor. Okay. Yeah. So this ends our session. Yeah, thank you very much. Let's I hope that through this video you will be able to generate some more thoughts and questions to ask when we come back and discuss during your live sessions. Thank you.